Hi everyone, my name is Caitlin Markin and I'm going into my senior year of undergrad this year. I'm majoring in kinesiology with an emphasis in physical therapy along with a minor in psychology, and I'm applying to grad school for physical therapy within the next few months. With 2020 going the way it is, I wanted to help inform everyone of what COVID-19 is, how it affects the body, and how to help rehab it in outpatient therapy. SARS-CoV-2, more commonly known as COVID-19 or coronavirus, was named after the previous viral epidemic SARS-CoV in 2002. COVID-19 became noticeable in December of 2019 in Wuhan, China. The virus had spread to 18 different countries by January 30th, 2020, before eventually making its appearance in U.S. territory February 26th of 2020. COVID-19 is a RNA virus that has a crown-like appearance due to a spike in the glycoproteins. This virus uses angiotensin-converting enzyme 2, also known as ACE2, which is an enzyme that attaches to cells in the lungs, heart, kidneys, and intestine as a receptor for cell entry. The reason COVID-19 is far more dangerous than SARS-CoV is because it binds to ACE2 10 to 20-fold higher, which allows it to take over the cell processes, and it replicates itself to invade new cells. With this virus binding to ACE2 receptors, the white blood cells rush to alveoli and release inflammatory chemicals. In response to these inflammatory chemicals, the blood vessels surrounding the alveoli become leaky, and those leaky fluids put pressure on the alveoli, causing them to collapse and become destroyed. These collapsed and destroyed alveoli can be shown on chest x-rays or chest CT scans. This is the main cause of the more severe cases of the virus, making it difficult for people to breathe. As I'm sure you've heard 100 times by now, I would still like to review the transmission and symptoms of this virus. The main ways COVID-19 is transmitted is through coughing, sneezing, and even talking. Any way that droplets can make direct contact with a person's mucous membrane is a way that the virus can be transmitted. This virus can also live on surfaces and in the air for extended periods of time, making it extremely important to constantly be washing your hands. The risk of transmission varies by the type and duration. It is important to note asymptomatic people can still transmit the virus, so again, it is incredibly important to wash your hands. The virus has been found in urine and feces, but there is no detectable evidence of it in water or sewage. There are many symptoms like fever, cough, loss of taste or smell, etc., that typically show 4 to 5 days after exposure. There was a study done in Italy using 143 post-COVID patients with ages ranging from 19 to 84. These patients were assessed 60 days after onset of their first COVID symptom. At the time of this evaluation, only 18 were completely free of any COVID symptoms, while 32% had 1 to 2 symptoms and 55% had 3 or more symptoms. The most common symptom still remaining was fatigue, while there were still many others, and 44.1% of patients reported a worsened quality of life, giving you reason to make them feel welcomed in your clinic. With some of these symptoms being more severe than others, it can lead to hospitalization. For most acute care patients, they are just mild cases. Only 14% of cases are severe, and just 5% of cases are actually critical. While many of the acute care patients have not been able to leave their hospital room or bed during their stay, majority of the patients have had physical therapists help to prevent atrophy while they're in the hospital. All hemodynamically stable patients are discharged on supplemental O2, and the patients who are returning home with below baseline function require outpatient physical therapy, which is where we come in. 25 to 80% of all COVID-19 patients do show physical loss from ICU-acquired weakness. During your subjective exam, some important questions to ask would be, how many days were they in the hospital? How many days were they on a ventilator? Were there any complications while they were in the hospital? How was their activity level prior to COVID compared to their current? And do they have any current symptoms? It is important to make sure you do an exam for all the systems, including circulation exam, respiratory exam, musculoskeletal exam, and a neuromuscular exam, along with assessing the person's breathing pattern. Be sure to remember that vitals are vital, especially with this population. It is very important to assess the vitals as much as possible. Some objective assessments that should be done before starting therapy would be the 6-minute walk test, 5 times sit to stand, and the timed up and go. These 3 assessments will be important to record numbers so that you have a baseline to compare to throughout and after therapy to track the progress. Some ideas for treatment must include both movement interventions and respiratory therapy. Titrating a patient's O2 would be a great way to help with respiratory rehab. In order to titrate the O2, though, there must be communication with the patient's MD to verify the patient's safety. Another treatment idea for respiratory exercises would be deep breathing exercises like pursed lip breathing and diaphragmatic breathing. These exercises are important for repairing the alveoli in the lungs and making it easier for patients to regain a normal breathing pattern. Since most patients entering therapy post-COVID have been in a hospital bed for an extended period of time, it is important to include movement interventions in their physical therapy program. Progressive resisted exercises based on the results of the outcome measures standardized tests is one way of regaining muscle strength and endurance along with preventing any further atrophy. Manual therapy would also be useful for counteracting the hospital positioning from lying in a bed. Focusing on rib expansion will increase the space for negative pressure to occur during inhalation also. There do need to be precautions taken during therapy considering these are post-COVID-19 patients. It is extremely important to continuously check your patient's vitals because, as I said earlier, vitals are vital in this population. Continue to stay sanitary and wear proper equipment like your mask and gloves. I also recommend using a separate room with these patients just to take extra precaution. To review, the virus itself is as dangerous as it is because it rapidly attacks newly made cells. Most patients are rushed out of acute care to free up beds for more people who have the virus, so make sure your patients feel welcomed. Vitals are vital, and I cannot say this enough, so make sure to constantly check vitals with this population. Remember to get baseline numbers on their first therapy session so it is easier to track their progress. And be sure to focus on movement interventions and range of motion along with respiratory systems because that is what these patients need most. Thank you all so much for listening. If you have any comments or questions or would like my resources, please feel free to email me. I hope this presentation was of some help to you. Continue to stay safe out there.